Is nursing really as bad as some people say? If you've been on social media at any point, or maybe you've talked to some other nurses, you may have heard them talk about how much they absolutely hate nursing. They're underpaid, they're understaffed. If they could go back, they would have never done it. It's the worst job they've ever done. And if you're in nursing school, you may be wondering,
is nursing really that bad?
Well, the answer to that is yes and no. The truth is, nursing can be an absolutely great profession and you can really love working in it. There are so many things you can do. There's so many great people you can meet, patients you can take care of, and it has a lot of great aspects. However, there is a dark side where there are things that can cause you not to like your job. And I'm going to go over the top 3 things that usually cause people to want to just leave this profession and just say it's the worst profession ever. The first thing is that the facility that they work at is completely mismanaged. And whenever I say that, what I'm talking about is several things. One thing is that they are having unsafe patient loads. They have a lot of patients to one individual nurse, which is extremely overwhelming and not a good situation, which leads them to have bad job morale. The person's always stressed. They also don't get their breaks. They don't have enough resources to help them do their job. The second thing is having issues with your coworkers and staff. So whenever you're working in nursing, it's so important that you're surrounded by a team of people that support you and that you work really well together. And that really starts from the top with the manager. You want to have a good manager that's easy to work with, but they're a really good manager too. You don't want one that's overbearing. That can make your job difficult. In addition, having coworkers who are lazy, who don't want to pull their own weight. So you don't have good teamwork together and you're sort of stuck having to do everything all by yourself. And then the third reason has to deal with the specialty you pick. It just really wasn't a good fit for your personality. Many times, whenever we first start out in nursing, a lot of us really take the first job that we can get because we don't have a big selection sometimes because certain areas out there, they just want to hire people with experience and they don't like to hire a lot of new grads. So we end up having to take a job that usually doesn't go along with our personality. And then over time, we start to learn that, okay, this job is not for me, I don't like it. And then we might get in this mindset, okay, this is just how the whole nursing profession is,
and I hate it.
And the truth is, it really takes time as a nurse to figure out what you like and what you don't like and what your talents are and what you prefer doing in the nursing field. So whenever you see someone ranting and raving about how horrible nursing is, I'm not saying that their experience is not real because they have lived that experience, they have went through it, and what they're saying is true. So I want to keep that in mind, but their experience may not be your experience. In addition, that person who's having this negative outlook on nursing, their opinion may actually change over time, especially if they change jobs, they do something different in nursing. So just because they're having a horrible time right now may not be that they are having a horrible time later on. And I've known nurses who I've worked with who have absolutely hated their job. They wanted to get out, but instead they decided to, switch to another hospital system, and they've switched to other specialties like wound care, home health, hospice, case management, and they absolutely love nursing all over again.
Oh yeah!
So I would like to really encourage anyone who's going through this right now, you hate it, you don't want to do it, you're through with it, to really just look out there, make sure you've looked at other hospital systems, other specialties, and really try those before you just leave the profession altogether. Any job that you get out there is going to have downsides. Think in your mind right now, what's an amazing job that would seem like it would be so awesome to have. Some people may say a model. Well, if you get online and you just read or go to Reddit and read stories of people who are models, you're gonna see that that job ain't the greatest or most easiest job out there. So my point is, every job is going to have its downsides. So is nursing as bad as people say it is? In some cases, it can be, but in other cases, it can be one of the most rewarding, fulfilling experiences that you ever do. So you just want to keep those things in mind.